Okay.
Teenagers.
Good evening, everyone, and welcome to the Covington special meeting between the City Council and the Human Services Commission for Tuesday, April 14th, 2026. For roll call, I guess we'll just go around and introduce ourselves. So start with Jeff.
Jeff Wagner. Casey Hogan.
Jennifer Harger-Helson, City Council.
Jay Taryn.
Debbie Hartzog, City Council member.
Leslie Hamada, Human Service Commission.
Beth Porter, City Council.
Sean Smith, Council.
Catherine Williams, Human Services Commission.
Christina Zoltis, Council.
Sarah Parker, Human Services Commission.
Darren Patterson, Community Care Specialist.
Julie Johnston, Human Services Manager.
Regan Boley, City Manager.
Crystal Bates, City Clerk.
Okay. We have one agenda item tonight. Review the Human Services Commission's grant process and operations. And I guess I'm turning it over to you, Julie.
So Sarah's going to do the bulk of that presentation, but I just wanted to kind of give a high overview of how we ended up in this position, even discussing this tonight. So as you know, the last 20 years, I believe, we've been doing the funding cycle, the grant cycle a certain way. We have people apply for funding. The Human Services Commission then receives a very large binder and goes through all of the applications and spends hours and hours looking at them. And so, you know, after you've been in a place a little while, I think I've been here 10 years, which is hard to believe. You kind of start wondering if things could be done differently. And given the fact that we have the community care program now, this has really shaped human services of the city of Covington in so much as it affects me on a daily basis and my focus. And it became very, very apparent that the community care program was now shaping human services operations on a citywide level. And so then I started looking at the budget, wondering, hey, how could we do this a little bit differently? How can we maximize our dollars and support our in-house community care program? So it's not only sustainable, that it can maybe potentially grow a little bit and set it up for longevity in the long haul. And so basically that's kind of how we ended up talking about this tonight. There's a whole slide deck, and Sarah and Catherine and I have met to discuss this. And so I guess I'll just turn it over to Sarah to kind of dive in, unless you feel like I left anything out in the intro.
No, I think that's it. And so one of the things that we want to highlight is I'm going to try and get through the slides as soon as possible. So we have the maximum amount of time to really go into questions and answers, because this is a very big change proposed. And there are some holes that we want your advice and your input on, making sure that it's a robust proposal if it is implemented. We think we have a really solid framework, but this is just the start. If there's a vital question that you think needs to be answered right away, please go right ahead, raise your hand, we'll get to it. Otherwise, we're going to sort of get through this all and then open the table for discussion. And so as Julie was saying, the foundation of this proposal is not just shifting how we do things on a whim. This is looking at how the human service budget has looked over the last handful of decades in Covington, building on our strong foundation and additional information from our community. So we're not changing just because. This is reducing the administrative burden. We have, from a human services perspective, a relatively small budget. We tend to give very small grants, but the lift from both Covington side and for every single agency is very, very high for a very tiny amount of money. One of the things that I know we've talked about in our joint meetings in the past is additional emphasis on communication with the public and between our commission and our council members, and maybe expanding that to how do we get more involved with, King County Council, with our state legislator? How do we bring those bonds so we all are working together better? Sustaining our core programs. The success of Darren's program has been incredible to watch. We want to make sure that that is sustainable and that it can grow to its maximum impact. And there's definitely opportunities for growth. It can't, do all of the things, but there's room and expertise available to do more in what it is good at doing. And then additionally, we've been doing more community work and getting surveys from Central University. And we now have a better idea rather than just kind of going, well, we know housing is an issue. We know food is an issue. We now have targeted survey information that really let us hone in on our priorities. So casting out for a wide array of services and then just, throwing out dollars to whomever applies may not be the most efficient and effective option. These were really the highlights of that survey, what Covington is lacking, or there's gaps. Maybe it's not lacking, but people can't get to it. That strengthening of coordination across partners. We don't all have to work in a silo. We can do more if we're working together and we're building awareness of what's available. Housing and housing support was huge. That's sort of in our most needed resources, housing and food and some of those high ticket, financial items that really cause families to struggle in our community. And then this final one of, Covington is still a relatively young city. We're still building our identity. We're forging that sense of community and belonging. This is one of those, once we can stop, working on, patching the most urgent needs, how do we help people before they need help? How do we get people to help themselves? How do we keep them from falling into these desperate situations? And a sense of community and belonging where we can help each other is really key to building that stronger future. But that's sort of a long-term, little brick by little brick, we improve that. And so this is sort of looking at the scale of our, every year we get dozens of grant applications. And this year, I think we've already got over 50. So every year it's more, or every 2 years it's more. And so we look at how much time is allocated. This is all commissioners spend, this amount of time. Every meeting is spent doing this. We can't do anything else. We are solely focused on reviewing these applications between, April, October, November, and getting you our recommendations. And so it's every other year that the Human Services Commission is focused on how do we get dollars out, but not necessarily, is this the best impact for our community? And so if we can transition that time allocation, we're still going to get dollars out because that's how we get services provided. But is there ways to get more dollars in so that we can grow our services, that we can build on these programs? And so better spending our time as a commission.
And can I just say something about that?
Mm-hmm.
Yeah, so this slide is the total amount of hours every other year to review the application. If there's 7 commissioners, 60 applications, about an hour and a half per application, that's the amount of hours that goes into review. And that does not include the site visits, the agency reporting, what I do on my end, as well as the agency time.
Yeah, this is commissioner specific time. Yeah.
Mm.
And then one of the things that we were looking at is, if we transition away from all of our time going into, we're just allocating funds to partner agencies, does that open up big gaps that people are going to be struggling with? Well, a lot of agencies, this is a sort of a snapshot of some of our key partners. The amount that we fund them is less than 1% of their entire budget. They are providing amazing services and we want to maintain relationships with them. But if we don't give them funding through the grants, they are not at risk of ceasing operations. And so this is one that, how do we continue building those relationships if it's not through this same grant funding cycle, is one of those open questions, because those relationships are very important. But our dollars are not make or break for these key partner agencies in a lot of cases. And then again, they're able to deliver so much more than what we are paying for. So in that sense, you know, it's a dollar well spent because they're able to return significant services for it. But those services don't disappear for, you know, lack of, you know, $5,000 to $10,000. And so we don't anticipate this proposal opening up any new gaps in our services. I think what we've also really discovered is through these surveys and community outreach, the gaps that exist in our human services are not being served by any existing partner agencies. There is just nowhere to send people to get these services. And so that's why there is a gap, which is part of this new proposal. Well, if we have more funding, if we can work with new partners, how do we then fill the gaps that we've discovered exist right now? So without losing services, how do we build more services? And that was the focus of, well, if we have more time and more money, we can do more. But that takes a lot of effort to set up a new program, which we can't do if we're spending 800 hours reviewing grants every other year. And so while this has done really, really well for our community, the support and the, you know, presence of our community partners is wonderful. Well, I think we can do better if we are more targeted in our time and budget allocations, especially because we have this community care program now that is in the city that we know is being successful. We're hearing success reports, we're seeing success reports, and we're seeing that the public is really appreciating the outcomes. So we want to make sure that that has a way to grow. And so the proposal we have of how we allocate the budget that Human Services has, also thank you very much to Julie for shepherding the grant application for funding a new community care specialist position. That opened up a lot of flexibility. So we're no longer looking at a budget deficit where our programs are at risk. But if we're always relying on a single source, you know, one grant that would make or break our programs every 3 years, oh no, we're scrambling again. And so it's more stable as a city if we have multiple sources of funding for these programs. And so that's, you know, stabilization. And then if we can grow them, so we're not just relying on the same, you know, small pot of money, we can find new pots of money. Improving the efficiencies and impacts of funding. We've realized that, you know, we have these gaps. How do we fill them? We want our funding to be as impactful as possible. And then addressing the gaps in coordination, not just, you know, lack of services. Sometimes, you know, we come back to transportation a lot. Are there programs that we can get people awareness and access to existing services? So this is a rough proposal of, you know, we have a current budget of just over $150,000. What we recommend is of our, you know, regular funding cycle dollars, that, you know, 70,000 of that is normal grant applications, but we do a much tighter review. We've added an extra, you know, Covington specific question of, you know, do these agencies provide direct resources to Covington residents? Not just, oh, it exists if you can get to Puyallup, if you can get to Seattle. How are you serving Covington residents? And so being much more targeted, so we don't have to review anywhere near as many applications. And then really focusing on our core support programs for the community care program. AHA and Recovery Navigators is our key to that. They've become really important partners. And the other, you know, part of that is those relationships guarantee spots for Covington residents who need those programs. And so that's a case where the contractual relationship and the dollars in really, you know, brings the results. And so those are really important, minimum contributions that we need to consider. The two new things that we're proposing are, smaller buckets of funding, the Covington Initiative Program. This is what we envision more like requests for proposals. We have something that is urgent. We can do time. We can figure out how to do things just in time. A couple years ago, when we had some extra funding from federal sources, and we set aside a little bit of cash just to be available if a program or an urgent need came up, and we were able to fund some of those really cool programs that helped our community, like the bike storage. Being able to say we have this pot of money that we are saying we need housing, we need transportation. We're going out and we're asking agencies, what can you do for us if there's a $10,000 grant? What can you do for us? We need this. One of the things that has been already reached out to us for is a transportation program to get seniors to the Maple Valley Community Center. It's not a whole lot of money, but it would be a huge benefit immediately. And if they're restricted to only filing a grant every 2 years, we can't be like, oh, well, we've got this pot of money that fits one of our survey. We know it's an urgent need. Let's do this right now, and we can provide this service immediately. So that's one of those things where we'd like to figure out a few pilot, test cases of these urgent needs where partners are already identified to test this out to make sure that this is a sound investment of our dollars. And then growing our sort of outreach pot of money, not just to be able to, buy a couple of sandwiches for an event. We want to be able to translate and improve our materials. How do we get, pamphlets? How do we do poster boards? Can we get signage? And this is our increased communication and a marketing strategy really with the public to get that line of communication going. So this is going into a little bit more detail that the initiative program, the emerging needs and filling those service gaps, things that we've identified that none of our partner agencies and, to our knowledge, the same kind of agencies have applied for this funding cycle. Those gaps aren't going to be filled just by seeing who applies. We want to be able to reach out and say, we need this. We think these agencies are going to be able to provide it. Let's get a proposal together. But again, the regular funding cycle of, we know we have some of these key strategic partners that are local. They've been in our grant cycle for a long time, and we know they provide services in Covington, but we want to make sure the dollars are going a lot farther and having more impact and reducing workload. And so rather than giving a whole bunch of agencies 1, 2, 3,000, we want to set a much higher, floor. We want to give all of our partner agencies, 10,000 minimum, so that it's worth everybody's administrative effort and the dollars provide real impact to these agencies. So some of the example, these are longtime partners that we've identified through our grant cycles over and over again that are in Covington. They work with our communities and they're accessible. This is fantastic that we have these, but I would also highlight on the flip side, this is the only bucket of agencies that are actually in Covington for our residents. We've been funding partners that do provide services to Covington. Some of it is indirect services, 211, all of these, phone calls, but it's, I'm calling someone and they're going to help me and maybe I can get somewhere, or they're in the peripheral greater King County and we're hearing more and more, I can't get there. And so we want to make sure our dollars are actually going to agencies that Covington residents can access.
Yeah, it's true.
And again, so it's the direct support to the community care program. This bucket of funds ensures that Covington residents have those beds whenever Darren calls. Yeah, so we would be continuing on the theme that we did last year, where we go out and do some more, tabling. This is fairly informal. It's wonderful to have conversations with the public. We want to keep doing that, but we want to add in, let's go to the different organizations. How do we partner more with the Chamber of Commerce? Are there other philanthropy organizations out there that are doing duplicative work? Can we partner? There's some very interesting programs in other small cities where there's, voluntary donations from local businesses, but in exchange for marketing, can we bring partnerships through other avenues that maybe it's not just fundraising, but it's in kind, or, we had Nikki's just the other week that they did a fundraiser for, the food bank. How do we have more of these in community partnerships that provide awareness and services to our community? And so looking at those new partnerships and strengthening that type of relationship. And then spending all of that extra time that, we aren't reviewing applications, let's apply for more grants. How can we increase our funding streams to more viable options that, again, if one of them doesn't get renewed, our entire program doesn't collapse. It's a small reduction rather than the whole bucket. Okay, that was a really fast, high-level overview, and I'm sure you have a billion questions. I will open the floor.
Thank you, Sarah.
Mhm.
Yeah, I'll just open it up. Who has questions? Yes, Jennifer.
I found very interesting the slide with the organizations that show less than 1% impact their budget from our grants, because less than 1%, like I convert that to decimals, like 0.00, do we have that for each of the organizations rather than some?
We can come up with those numbers very quickly, but it's not in a single spreadsheet.
Okay. Yeah, I was just curious. I mean, it says a lot, but it would be interesting to see the impact, especially to some of the small.
Yeah, and one of the things that we have discussed is over the years, we have set the floor a little bit higher than it used to. It used to be, more, at least 500 or at least 1,000. Well, now it's at least $2,000 to make it worthwhile. But we also want to be equitable. Most of the organizations that apply for grants are at least mid-size. They've got sizable, hundreds of thousands of dollars budgets, but a lot of them are in the millions. They're large regional agencies that have multiple offices or places of service.
Revenues.
But we also want to make sure, again, if we know these big ones, they're providing a key service for, health point, that they're dental or healthcare, they're not going to help us with housing or transportation. And so when we see gaps, if we're then saying, well, how do we fill a gap? Well, what if it's a small new partner that is saying, well, what if we only did this? Or what if, you help us grow? So we don't want to necessarily cut off any of these smaller agencies just because they are small, but there is the risk inherent in a newer or a smaller agency. And so that's I think where filling in a potential partnership building with our new initiative program, we see a gap. Okay, how about we do a $2,000 project for just transportation for our seniors to the community center? And if they can stabilize and show their success, well, maybe we grow that partnership and the funding grows and we can do more and more. And we don't want to bite off more than we can chew right out of the gate. But I would say the majority of our agency partnerships right now are the mid to large size agencies.
I don't have any other questions for now, but just a comment that, it's what we've been focusing on a lot at my day job is change. And I must say, this is very impressive, and also kudos to the commission and city staff for creating a safe space so people feel like they can come up with this stuff and be inspired and just honestly have the courage to step outside the box and do something different. And really with Covington residents in mind and leveraging what we've been doing with Darren's work. So anyway, that's just my comment. I may have more questions.
Okay. Jeff.
First off, can we get this slide, this deck?
That,
I'll send it to you.
yeah.
Okay. Can you go to the next slide, please? So I agree with what Jennifer said, that you're coming up with change and stuff. So if you're, in your opinion, if you're going to drop, let's say you dropped some of these fundings, how do you feel that our residents will still, I mean, look at behavioral health, youth and family, 806 sessions, even though we're only funding 64. How do you think that's going to affect our residents if we're not funding?
I think at this point, it won't, because the services are provided by amazing professionals that love what they do. I think it is something that we want. We do want to explore how we maintain our relationships with our partners, and whether that's doing more service events, helping them in their marketing. One of the things that I know we've wanted to do for a while is figure out how to do coordinate some social media and highlight the work of our partners. And that's part of, how do we get more awareness for the services that are available? When Julie was doing all of the service fairs, they were thrilled to come and participate in that. So finding the way to connect folks might be the new model, but we'd want to, not just disappear from their emails or, not show up to their events anymore. We don't want to create new gaps.
I would just, wherever you go with the funding, I just want to make sure that we're not taking Kent Youth and Family for granted if we don't fund them. But I'm not saying you're not going to fund them or anything, but I don't want to take any of the organizations for granted, but putting a bigger bang for your buck with some of these other organizations, I'm all on board with that. That's all I've got.
Okay. Debbie?
Thank you. Well, I'll just echo what Jennifer said. It is very innovative, and I like this idea. I like that what Darren and Julie started in the city has become almost like the model for many other cities, and it's encouraging for me and most of the other council members when we talk to HOAs and we talk about the fact that when they see homelessness, kind of, well, what happens behind the scenes? Because we don't want them to think it's just our police department going out and kicking the can down the road. So we tell them exactly what happens, and they're always very impressed. So I think that if we can fund more of that, that's good. I had a question about the Covington initiative. Is that meant to be more of a grant where services and service providers will seek us out for that funding, or you talked about just in need? Is it more you will know what's happening out there that you need to help fund, or they will come to you?
I think at the beginning, because it'll be a new program, we'd be reaching out. We've addressed some key gaps that through our surveys and outreach in the last handful of years. And so we want to reach out to any agency or organization of any kind that is doing that work and going, hey, we've got this new program, we've got a bucket of funds, send us a proposal. But I think if this gets established and it's known that, every year there's a bucket of funds that is available for just in time or an emerging need, please come to us, send us a proposal. We think we can help you. We'd love to sit down and listen to that and see if that's something that will fill a gap that we haven't, addressed in the past. And so that will be a bit of a give and take of, I think, as we're getting this new sort of dynamic up and running, what we would like to do is shift the commission's time from grant review to going out and doing the groundwork, the legwork, talking to people to get these up and running, so that it's not just we're sitting on this pile of money waiting for someone to knock on our door that no one knows we're here.
Okay, thank you. And then just follow-up question. So the number of agencies out there today that we fund, how do you get the word out that you're going to be taking a different approach, and you may not be inviting them to request funds again? And then on the flip side of that, how do you stay out of receiving 60 applications a year? Will you get next year, even though we've changed the model, are you likely to get another 60 applications?
So I don't know if this will answer your question, but I created a supplemental questionnaire that goes out with all the applications that says, how will you impact, Covington residents? And kind of lists out like criteria that we're looking for, and if they meet that, then they can apply it. It's through a like universal application. It's called Share One App. So anytime someone applies for funding, they can just check which city they'd like to apply to. So that's kind of how it works on the back end. But for Covington specific dollars, I've created kind of a supplemental in addition to the application that will kind of hopefully narrow that down a little bit.
So
Is
while
that
yes,
okay?
we would still get however, as long as we're participating in this multi-city program, we will still get however many applications that come in. I think Julie said there's already 50 for this cycle. But this will let us do a cursory review, take 5 minutes to review that page, do a quick flip through to make sure it's not an agency that, just did a bad job answering that question, rather than spend 2 hours reading the full application. So we can do a very quick sorting and go, okay, here's our priorities. Let's spend a quarter of the amount of time really picking the right fit for the agencies we're going to use for that process.
Thank you.
Others?
Well, I might add that I've kind of had a second career that I didn't plan after I quit working. So I've worked as an emergency assistance director for Canton United Methodist Church for over 15 years. So, and I've watched that program grow over the years. And unbelievably, we have 150,000 in our budget. We started out when I did this 15 years ago with 6,000. And I kind of tunneled on my marketing background and some of my communication background. And I think that would work well in Covington too, is to go out and work with people, tell them the message that you're trying to go as a city, how you're trying to develop it, but also showing concrete testimonials that you're helping within your own region. And the word that would get out would, you wouldn't have to put it out there. It's going to get out there the way it is. And several of the other cities I'm serving on regional committees are actually going toward a model. I talked to about 3 of them. They're changing the model. They're doing human services and to be a little different than following that every city gets so much, these huge agencies. And quite frankly, a lot of these agencies have, their money is tight. But I think one thing that you gain, and what I found from being on the Human Service Commission for 9 years before, and came back because I guess I just think you need me.
We do listen.
Yeah.
I don't know about that.
You were bored.
Yeah.
Yeah. Anyway, I think that it helps when we go out to where people are at. I think there's so many people in the city, even though it's 23,000, I don't even know what the population is now, but yet they get lost. And when you come out to their agencies or their culture or their particular situation or their diversity and should show interest in what they're doing, small projects. My husband and I started a Kenny Still Boxing on a shoestring budget. And I'll tell you, when you start stuff like this, if you get people to believe in you, the groundwork is the hardest part. It really is. So I just think I was excited about this model when I heard about it. It's kind of what triggered me into it. So I hope you'll really consider this. And in times like now, we really need, if anything I've learned from running campus campaigns, propositions, is money's tight right now and people are stressed out. And if we're going to get behind these things, we really have to show value the community really wants. Get behind it.
And I think the other benefit to really focusing on local communities or organizations that have at least a local footprint in Covington is being out there all the time, because a lot of these things take time to grow. And so if one of the things we noticed a lot, at our tabling events is, well, what are you doing about this? What are you doing about this? Why isn't this getting better? And actually in the background, things are moving forward, but there wasn't a way to communicate that. And so when someone says, well, how are our parks getting better? How is the walkability getting better? And, how am I able to get to the community center? How can I get to the food bank? Well, there's a plan for more sidewalks. There is a plan for improving our parks. There is a plan for all of this. And so if there's more touch points where if every year someone is able to ask, well, how come we don't have this yet? You can say, well, actually, we started that 5 years ago and we're at milestone number 7 now. And, we can, and so building that public trust in local government, I think, is also a key part of this.
So I mean, I want to echo what everybody's feeling. I think it's fantastic that we're looking at ways we can better use city resources, what it amounts to. And volunteers that put so much time and effort into doing this can shift that focus to building those connections in the community. Is there a way to like narrow the focus of which groups apply? Like if we know that we're looking at transportation for seniors and food and housing and is there a way to just narrow that it has to fit one of these 5 areas of whatever of service so that we're getting applications that you feel are important to our residents? Okay.
I would say yes and no. Yes, in that we can be more targeted in saying explicitly, here's what we're looking for, not just human services.
Right.
We want transportation for seniors. We want after-school programs for our children. We want food assistance. We want housing rental assistance. Theoretically, grant writers are trained in, here's what I'm good at. I'm only going to apply for the grants that meet what I can provide. But as Leslie mentioned, money is really tight. And so it's become increasingly common in the nonprofit world to try and put yourself in as many buckets as possible. And so you're getting more grants because everybody's going after any possible dollar. And so I think if we're in the general grant application, we can figure out how to narrow it down more on our side from what is applied, but it's hard to discourage people from applying if they don't fit well. One of the things that we would like to see, the initiative program is only $25,000. Now we want to pick a few key programs so that we're not overstretching ourselves as we're starting. But one of the things that this could theoretically do is supplement, we could just not do the normal grant program. We've built relationships enough with our long-term partners that rather than have them apply every 2 years, we know what they do. We have our requests for proposals. They're targeted to those services we know they provide. And we do a specific Covington request that people know they can apply for these funds.
Yeah.
And it's a sort of a slow transition of the entire program, but we don't want to change things too rapidly and then drop all of the balls.
Right. And I guess that was my other question too, is
Yeah.
that we don't have to put everything out for grant requests, right?
Yeah.
Staff or, human services can
Yeah, I think
seek that out. Okay.
the key thing is making it a much simpler process is also important because
Yeah, well, yeah, you guys.
It's pages.
I mean, it's just what I think one of the key things is if in the joint application, it is what it is. There's quarterly reporting, there's annual reporting. I don't know any organization that wants to do hours and hours and hours of work every quarter for too much money. If we're talking about 10, 20, 30, 40, $50,000, I'd want a bit more reporting. But if we're talking about a local organization that is small, we have a relationship with, we want a $2,000 program, they send us a 1-page annual report. What is the balance between efficiency, but also appropriate stewardship and oversight of applications for effectively taxpayer dollars? We want to make sure that this is all above board and done properly.
And then just one final question, if I might. Do we keep track, especially with the Community Care Navigator program, how many of those residents started out living in Covington and then went to the parking or the home? Or then went into their situation where now you have to have a Community Care Navigator assist officer?
So are you talking about from law enforcement contact to?
Sure, like, so.
I think
might not be
were they a Covington resident and then ended up
in the parking
living
lot, yeah.
unsheltered? Or I think you go ahead and answer, but that's the question.
Yeah. I informally keep have track of that, just kind of by the registered address. You know, just what they provide me, and more often than not, it tends to be a Covington address. But there was a period of time where I did see folks from like out of state, you know.
Right.
And so, you know, I do track it informally, but I can keep a closer eye on it.
Yeah, 'cause I mean, it's a great program. I'm not saying you should change anything, but I think, you know, residents, if they see their neighbors suffering, like that's the person they're probably gonna want to get help with rather than somebody transit into the community that may or may not. I don't, it's just helpful that I think have a statistic so we can go, hey, no.
I
this is
think a
what happened.
registered address though, for someone in that situation is not a good source of data.
That's
Very true.
Yes.
Yeah.
That's very true.
And that's why I've been cautious.
Address, like, you know what I'm saying?
Yeah, I agree. Right,
People
and
that-
but it's hard to get from them.
I think it speaks to,
Yeah.
at one point, they were living in Covington, which I think is what you were.
Well,
Or they have a relative.
I mean, if we're,
Or-
how
that's
about
true.
residents that have lived here for a bit and
Yeah.
have fallen on hard times, it's, you know, it's a little bit of a different approach. I mean, we're helping our groups in our streets safe and we're helping humans, like, so it has value to it, but some people might.
Yeah, I just don't know, we could do something sound with that data.
Yeah.
as it is.
You don't know what's, yeah.
Well, I think too, though, you're offering a service to your business.
Oh, yes. that's
I
what-
mean,
okay.
and you all got my letter that I sent you. To be able to call and see that somebody's looking into it.
Mhm.
If I owned that business that that person was in
Sure.
front of, I wouldn't want to go out and say, you gotta get away from my business.
Yeah.
It's pouring down rain, you don't have, I mean, who wants? So we are offering, even if they're, wherever they came from, they've landed here,
Right.
homeless, we're offering to Covington people a source of correction to get them back on track.
Jeff,
I'm looking at this slide. I know the Covington Initiative Program is in its infancy stage, so I know that the regular funding cycle comes back to council. We see what it is. What are you envisioning that this 25,000 is spent on? Does that come to council so that we see it ahead of time, or is this just money that's there that is handed out? How is this?
So that is something that is probably part of a larger discussion between us, like maybe you want to have, you know, small contracts be under the purview of the Human Services Commission. You give us guidelines of what, you know, you think those funds are appropriate for, and we can just oversee the program. But if it's something that's a higher dollar value, maybe that's something that, you know, goes to council for approval. These are things that, as the program grows, I don't think it's a one size fits all. And at the end of the day, it's what council is comfortable with.
I can touch on that too. I think the point of that was to address kind of immediate needs, and if it has to come back to council, it won't necessarily be doing that. And so that's why it's kept under mine and director's signing authorities, so that council approves that sum, but then the individual help that goes out is done on a more immediate, under director signing approval.
And could we get visibility in our weekly
Sure,
update?
sure.
Because at least, because that's a great question that Jeff
Yeah.
has.
Yeah.
It's not just control of the money, but it's also our visibility on how we're serving our
Totally.
residents so
Yeah.
that we can speak to it.
Yeah, easy. Yeah, that's no
Because
problem.
it's public funding.
yeah,
Yeah.
And we need to be aware
Yeah.
of where the money's being spent.
Yeah,
Yeah.
and it's similar to other lump sums that council approves in the budget, and then the directors and myself have signing authority that we put it out, right? And so it would, but what I'm saying is we're not setting a new precedent, right? This is something that we do in the regular course of business, but we track it and we'll get it to you.
Yeah, and I would say one of the things that was sort of not the impetus for changing how we're doing it, that was mostly funding and impact, but also with new information, we get so much data from Darren all the time, and it's, you know, up to date. You know, we get snapshots of what's going on every week, but we also get the quarterly and annually updates of how the program is running, which shows us, you know, the people in the most dire straits. What are the top priorities? What do we need to make sure we're providing? And that increased, you know, budget of being out in the public, continuing to build on the surveys that we've done. So we're doing our own data collection and building our own information in-house rather than just guessing. Like it's not a hard guess to say people are struggling financially, and housing and food and healthcare and childcare are pinch points for folks, but we're not just gonna do the one central study and then say, oh, we don't need to look at what our people need anymore. We want to have regular touch points to make sure that the data we're collecting is shared and acted on.
And I will say the one thing, with the growth of the community care program, to speak to you, is that we do want to do more than just who Darren is like helping to coordinate on the street level. We do want to branch it out more, but we have not been able to do that because we don't have the staffing. But we do apparently have that coming to us, which is very exciting. So I'm so thrilled about that. But yeah, we should have the capacity to make it a broader program.
Others? We'll just take a second here. Well, a lot of my questions already got asked, so that just shows how in line I think the council is on some of this thinking. I like the idea that if we eliminate the grant program, that's going to free up some time for the commission to do other work, like look for additional grants to support our work. And then going out in the community, I guess a question for Julie, as we make this transition, what's the work plan going to look like for the commission then? How are we going to, I don't know what the word is, institutionalize maybe these new expectations on what the commission should be doing? And what additional source? I know that's 800 hours, that's volunteer time. I mean, that's not what but
Yeah.
that was just one thing on that. You're reviewing all those applications. Well, that's input from the community on what is in need in there. So we won't be getting that direct communication anymore. So I guess two questions. What are we putting into the work plan? And then how do you envision, if we're not getting these applications, we may not know about an issue that we wouldn't get an application for?
We're still getting applications though with this.
We are still getting applications to some degree. They'll be more focused on Covington. But I wouldn't say we're dataless because we have our robust system of Gelada that Darren works with. And it's since to date, it's kind of been limited to the people that Darren's been interacting with, but that is going to grow now that we have more staff support. So we definitely have data and will have data. And then to answer your question about the outreach plan, that is up to the commission, I feel like. I mean, I don't want to defer the question, but I think we need to talk about that as a commission and really discuss what's going to work and what's not going to work. Resource fairs, I don't know about those. When I was running them, the attendance was very low. So we kind of need to talk about whether that's the best way to go or not. I think it was very successful being at our already plugged in events like Covington Days, like partnering like at Makers Market, things that are already happening. That was a great way to get the word out. I don't know if the commission wants to keep doing that or if there's other ideas. I mean, this is all new. So, we've never had the bandwidth we've had the bandwidth, but we've had the prescription to go through and look at all the grants. And I don't think this has been on the commission's radar that they can't even do this. So I think we just have a whole exciting prospect ahead of us, really.
So if we've, as a commission, we already are, committed. We know we've signed up for this. We're volunteers. We're happy to do this work. We want to be helping our community. And so if we go, okay, well, I've got a bucket of 500 to 800 hours that I already thought I was spending on something else. Well, what if we each commit to going to different community meetings? We go to the chamber, we go to Rotary, we go to churches, we go to schools, school boards, places that are already sort of tied into a local community and see their programs. Are there synergies that we combine forces? So doing, the tabling events, just getting casual conversation from our community. Those are low lift, fun, and informative. They're easy to do. I think we'll continue doing them. But figuring out how do we get these first initiatives up and running is going to be a critical priority. The ones that have already sort of an identified partner, like transportation for the community center, sort of seems like a really good start. but what are, maybe 2 or 3 others that are ready to go with something? What funding would that look like? How does the oversight look? What is the reporting? What does it look like? So designing that would be another, bucket of time. And then, spending some time, what are the grants that we can apply for, and actually writing out those grants. So those are sort of the activities that have floated to the top of our priority list for this year's work plan. So if this is a proposal that it seems to be pretty well supported, if this is approved, and I would say probably our next meeting is, what is our work plan? Let's pick 2, top priorities and get them done.
Yeah, Jennifer.
Speaking of the events, I was curious if anyone on the commission or staff has gone to that event. Maple Valley mentioned at Tri-Cities. It's the last, I want to say Thursday of the month.
So like the King County Resource Fair.
It's
Is it in
tomorrow
March?
to Maple Valley, and
Tomorrow has the volunteer
She said
event.
something about she was gonna spend the night there or something. She's gonna be back. Darren's counterpart,
Harry?
Carrie?
Carrie. No, works for Maple Valley.
Greta?
Greta, thank you.
Oh.
Gee, I was like, no. Yeah, it's I got the strong impression, it's Maple Valley. Everyone, all the human services or related organizations that support Maple Valley, not King County. There was a King County like specific
Yeah.
focused one, I think the following month.
Mm.
But I was curious if anyone's gone to that, because I got the impression that it's just kind of like an update and share.
Mm.
And just in that way they can plug in to each other pretty quickly and kind of almost like feed exactly what you were
Yeah,
describing.
if we don't have one of those, we should figure out how to
Yeah,
make one.
Greta's the one that mentioned it because she said she was gonna be spending the night
Mm.
there
Yeah.
because it's literally the next corner.
I don't know, not sure if it's not the King County one, I don't know which.
Yeah, I think it's monthly.
Oh, okay. Look at that.
Yeah.
Yeah, and again, so if there's any of these already existing, like potential partners or outlets or avenues that we haven't been able to, do in the past that you seem really promising, you should hit as many of them as possible to see which ones are worth adding to the schedule and being regular participants, because that's how the relationships are built.
Any other questions? Oh,
Yeah,
Debbie.
actually, not a question, but I know that we've been funding, is it Sound Generations,
The Meals on Wheels.
Meals on Wheels, and then there's
Volunteer transportation.
the transportation.
Yes,
version of
Sound Generation, yes.
that. Okay, thank you. So that is one that is one of your like anchor partners
Yeah.
that you would.
Yeah, so I just want
Okay.
to clarify this list. This is just a possibility. I don't know if I'm assuming these agencies have applied. But just based on last year's funding, this is what the list I pulled. Likely they probably applied, so this is like a tentative list.
Okay,
But yeah,
because Sound
Yeah.
Generations does senior transportation,
Mhm.
I think.
And that's sort of one of the pinch points, is their wait list is huge.
They're not in the same.
Yeah, and so that's one of those things of, well, rather than go through the general grant and we give you a tiny bit of money and maybe our people get added to a wait list, well, if we go, we have a particular need, can you fill it for this bucket of money? Suddenly we're a different program and there's not, so like where are the, not every organization has the staffing to do that, but if there is more funding for a specific program, maybe they can bring in a specific staff or an organization partner or
Add a day
something.
to the.
So
Good.
that,
idea.
Thank you.
maybe, we want to build or transition those meaningful relationships so that they're strengthened rather than being like, well, you get our, here's our pennies and hopefully everything keeps working maybe as good as it has in the past. How do we get everyone better? Yeah,
Other question, comments?
we've got about 5 minutes.
Well, actually, we got about a half hour still, but
Oh,
yeah. Well, I see on here, question for the council, basically asking if we agree with this proposal. Proposed reallocation and operation shift in Human Services Commission. So you're looking for consensus or feedback.
that would be great.
Yeah.
Before we do that, I would just I did hear the council on a couple things. We want more, some of the things fleshed out a little more. Maybe some more detail on how those Covington Initiative grants would be potentially approved. Were there other things that people wanted to see? Because I think. Okay, so I guess just, yeah, go ahead.
So you think council's not ready to approve?
No, I
this
think we can
tonight,
give,
or-
but if,
Okay.
but if there's, we're expecting there'll be some additional,
So on that
feedback.
one, was that you wanted a report submitted, or there's some additional information you want before it started?
well, I'll just back up. Are people comfortable with what Regan presented on how we would do the Covington Initiative? Okay, so I guess we don't need it. Yeah, no, that's fine.
Just to ask for the report out.
Yeah,
Yeah.
absolutely.
Yeah,
I was talking to Julie, maybe like a quarterly report that we'll get to council on how those funds are spent.
great. Jeff, sorry, did you have a question? Or comment?
And I think from the commission's perspective, one of the things that we greatly appreciate your support and interest in all of this. This has been a heavy lift, and thank you, Julie, for putting this, starting this ball down the road. And we've been working on this really, really hard because we wanted to bring you a very complete proposal, but knowing that there are still open questions. And so, regular communication and any suggestions, in addition to, I'm concerned about what this looks like so that as we're building out the program, we can send you, here's what we did this meeting that, responds to the question you had. Or if you have any recommendations of priorities or organizations or partners we should, work with first. We want to get the ball rolling really, really fast. And you all have deep ties and care for the community. So we value your input.
So going off of that, I know that you're just getting the applications in now. You're gonna start in the next couple of months. Doesn't come, you don't finalize it until late fall. What are you looking for, like what you just said, what are you looking for from us for that? And also going back to the Covington Initiative Program, are you looking for feedback on what we envision that going to as well?
I think the additional, feedback or, openness about what are the concerns that you've expressed for a new program. That's where the back and forth communication, I think, will be most helpful. How we review our grants will be the same process. There will just be fewer of them that we're giving more dollars to. And so that's the same process from the council side.
Thank you.
No other questions, comments, conversations, good. So go ahead, yeah, Beth. And
When you all do the review, the grant reviews, is it possible, like, just at the end of the day to get a list of everybody that applied and then who you approve, or who you feel should get approved, like when you bring it to us for our budget finalization?
I think that's,
I mean, like.
I think that's the plan, just like
Yeah.
each year, yeah.
Yeah.
That won't
Yeah.
change.
yeah,
That's all.
it just will be a much shorter list of recommendations than it has been in the
Yes.
past.
okay. All right, and then question was, they're looking for consensus on if the council agrees with the proposed reallocation and operation shift in human services, in the Human Services Commission. So I guess I'm just looking for thumbs up from the council or so. Yeah, yep, okay. You got consensus on that, so great work.
Thank you so much.
Appreciate all that you do for our community, and looking forward to how this change is going to magnify and target impact in our community. So great work.
We're excited about this.
Well, with that, I think we are done at, it's gonna be 6:29. So